Ladies and gentlemen, welcome once again to the Think Clinical Podcast. My name is Hamza. Great to be here. Thank you so much. This is going to be another very exciting episode. Please remember to subscribe, like, and share. Today we are going to be talking about just AI healthcare, and I like AI. I like talking about AI because I think there's a future. A lot of people are trying to run away from it, but the faster you run, the faster it chases you. So healthcare is one of those industries that we cannot do without AI. So this is going to be part of our conversation today, and we're just going to look at AI tools that doctors actually want to use, because if I was still in clinical practice at this point, what AI tool would I want to use? What would actually bring me value? Because we look at things like companies implementing $50 million AI diagnostic tools, and they look at their intervention 18 months later and realize that their adoption rate is just about 11%, and it's just because it added at least 14 more clicks or 15 or 18 more clicks to what they have to do in a day, just because we thought we were solving a problem, but we created another problem. So this is going to be very important in us really understanding what doctors actually look out for. So we have to also pay attention to the fact that some AI tools actually add more friction that doctors that want to just avoid them entirely. And we have AI tools now that are getting between 80 to about 90% adoption rates, and we have tools actually in the system now that doctors are actually pushing hard to keep, and even trying to work within budgets to be able to keep it going, because it has a lot of value. So I'm going to be looking at just 5 tools today, 5 tools that actually doctors want to use. And if you are a developer, if you are a tech company, you are thinking about getting into this space, you have to be looking at these 5 categories and things that actually work. Before I go into that, we have to first of all cut through the AI hype, right? Now, this is a $20 billion industry according to research, and this research is as early as 2023 2024 research, right? But here's the secret: 75% of providers say they've been pitched AI tools that don't fit their real workflows. 75%. This is a huge number. And so there are solutions in search of problems. So you have people who have built solutions, and they're now looking for the problem that it can solve, because they had this epiphany and they were like, okay, this is something I think we'll be able to get done. And they went in there and they were like, okay, now what do we solve it with, right? So clinicians, and I'm talking as one, we just care about 2 things. Does this save me time? Because there's so much that needs to be done a day that the focus is going to be on what will save me time or give me back my time. And the second thing is accuracy, because this is patient and this is human life at stake. I need to be able to rely on a tool that can give me accurate information while saving me time. These are the 2 things that you should be thinking about. And if you're a developer, you are thinking about all these things, you have to start thinking about a problem. That takes away a lot of time from the clinician, and also a solution that will give back that time to the clinician, and also be accurate enough for the clinician to be able to rely on and say, okay, yeah, this is correct, I can let this go. Okay. So if your AI doesn't give them back time or improve clinical decisions, just know that adoption is going to fail. Okay. And we have to look at this from research. And an American Medical Association published a survey in 2023 showing that 59% of physicians are excited about AI, but only if it reduces administrative burden. So I'm adding all this context to this conversation today because we have to understand what the root and motivation is for doctors to be able to adopt AI. And then just 2 things: any tool that saves time and is accurate, or both, this is a winner. And this has been shown to have a lot of adoption rate. So my litmus test for AI healthcare is that, does it eliminate something from the clinician to-do list, or does it add a new task disguised as assistance? This is the litmus test. And this is a question you should always ask yourself when you are deploying or trying or even thinking about AI tools to consider. Now, Let's talk about the first tool, which is the AI triage system. Now, this is the front end of everything, and this is not there to replace doctors. It's about routing patients correctly before they ever consume any form of clinical resources. So think about it. Your front desk, your nurses, your urgent care, how much time have they wasted on patients who don't need to be there, or who are in the wrong care setting in the first place? So these tools have been very instrumental in places like Cleveland. When they piloted their AI triage chat box, it reduced unnecessary urgent care visits by 15% in 6 months. And that's not a small number when you are running a multi-site location where you have so many patients coming in. Those were patients who either could have been managed at home with guidance, or needed to go to a different care facility entirely. They didn't need to come. So that time that your front desk, your nurses, and your urgent care team would have spent triaging these patients didn't happen, because they got triaged through the chatbots, right? So why do doctors like this? Because it decreases the noise. And it means that patients who do arrive are the ones who actually need the expertise for that specific setting. So it served as a filter and not as a gatekeeper to healthcare. Now, for founders, think about this as your patient funnel optimizer. And usually marketing, we talk about reducing unqualified leads to the top of the funnel so your sales team can focus on closers. AI triage does the same thing, reduces irrelevant cases at the top of the clinical capacity, and it allows you to spend the most time and get the most value for the patients who actually need to be there. This is the first tool that you need to be thinking about. Anything that helps healthcare organizations and helps doctors triage patients is a win already. The second thing is AI diagnostic tools. I've seen this so many ways in medical and in dental. And these, I've always said in so many of my episodes, that these AI tools are not here to replace doctors. They are supposed to augment the decision-making process. They are supposed to serve as a second opinion, second set of eyes, your safety net, a decision support tool that flags what a clinician might have missed. And we are human. You might be going all day, and the only reason why you missed something was because you are tired, not because you are incompetent. So when we look at a study from Johns Hopkins in 2022 showing the diagnostic errors affect 12 million Americans annually. 12 million. These are not bad doctors. And having been in that space for a long time, I know what this could be. These are cognitive errors that happen when you are seeing 30 patients a day. You're tired and you are pattern matching based on the most common presentation because you just stop thinking at some point. These are the challenges that you are having with these locations. So why do doctors like this, or why would they like it? It's not competing with them. They are seeing these tools now as collaborative. They remain the decision maker, but with better guardrails. And it's like having a colleague looking over your shoulder saying, "Hey, did you consider this? This could have been the angle you could be looking at this from." And from a founder's analogy, think about this as GitHub Copilot for medicine. Copilot doesn't write your code for you. It suggests completions, catches errors, speeds up your workflow. That's the mental model that works. So you have to start looking at these, and if you're a developer, you have to start looking at tools in the database. These are going to be very helpful. The fourth one is AI claim scrubbing, which just is not as sexy, and it's not the sexiest category, but it might have the highest ROI yet, because revenue cycle management eats up about 15% of every healthcare dollar, according to the Healthcare Financial Management Association. And this is a big waste, and you have to change Healthcare, for instance, published data in 2022 showing that practices using AI-powered claim scrubbing report 30 to 40% fewer denials. Think about that. It means your cash flow is secure, is solid. And if you're a small practice doing, let's say, $2 million a year and 10% of the claims get denied, that's $200,000 stuck in appeals. Cut that in half, and you freed $100,000 into working capital. This is all that we are saying. So why would a doctor want this? Because I have fewer denials, I have more cash flow, I have money to be able to run my clinic with. So that's the fourth one. And the fifth one is AI chat and documentation. Again, as I said, anything that saves a clinician time and saves and then actually is accurate, is the best tool. So I have seen this employed is one of those tools that even doctors wear them as just a pin here, and they're able to take as much notes as they come from the patient, and it goes directly into the patient chart. There's a conversation, there's details of something they could have missed or what they could have missed just by depending on their memory. So this is the big one, and this is becoming really, really big. And then documentation has been proven to be the number one driver for clinician burnout. So Annals of Internal Medicine published a study in 2021 showing that clinicians spend 2 hours chatting for every 1 hour of patient care, 2 to 1. That's why doctors are working until 10 p.m. finishing notes. That's pajama time, right? So you should be looking at that. And so we have AI tools that have been flooding the market and have helped to really take this burden off clinicians. The last tool I want to talk about is AI remote patient monitoring. This is becoming new. This is a bonus I'm adding up, but this has become very important in chronic disease management. So I think we have to be looking at these in the grand scheme of things. So if you're a founder or an operator, here are your 3 questions to filter through your AI tools. Does this save 30-minute plus time per provider per day? Before you even go to a provider to have that conversation. If it's less than that, the juice isn't worth the squeeze, because the amount of money you invest, the time you use to train, the time investment, the frustration and all those things is really not worth it. Secondly, does it remove workflow clicks or add them? If it adds steps, it will fail, full stop. Thirdly, does it improve outcomes or reduce risk measurably? If it is just cool tech without any clinical operational impact, just pass on it. And so AI doesn't have to be AI doesn't have to have a buzzword soup. It just, the real winners are tools that doctors beg to keep after the pilot. Triage that reduces noise, diagnostic tools that prevent errors, claim scrubbing that protects cash flow, chatting automation that gives doctors back their evenings, remote monitoring that prevents hospitalizations. These are the things that doctors would beg to keep and have. Founders, here's the challenge. Stop chasing the hype cycle. Just start building and adopting AI that clinicians actually want to use. I am your host, and this has been the Think Clinical podcast. Thank you so much for joining us once again. Please remember to subscribe, like, and share, and we'll see you in our next episode.